I chose cornea not by my choice. In fact, it was an accident. And what happened was, during my MS in Medical College Rohtak, I was learning things which were very old, and I realized that the skills I am picking up are not good enough for me to practice eye or ophthalmology for next 40 years. Therefore, I am looking for enhancing my skills. Then one of my friends told, there is a institute called LVPEI Eye Institute in Hyderabad. Just now it has opened 2 years back. You come and do a cornea fellowship. I asked, what do you mean by cornea fellowship? He said, देखो वो ऐसे ही बोलते हैं cornea के fellowship है, लेकिन इसमें अच्छा cataract सीख लोगे. Cataract अच्छा आएगा तो कमा पाओगे. So I just went there for an interview and I got selected, and that's how I landed up in cornea in LVP. I have been in cornea now almost 25 years, and the daily kick I get is by doing excellent cornea surgeries, especially when some of my patients tell me how it has changed their life. For me, it is just a corneal transplant, but for them, it's a new world. It's a life-changing surgery. Like one of my patients from Dehradun, she underwent a surgery for keratoconus corneal transplant several years ago. Whenever she comes, she will bring a gift. I tell her, why do you do that? She said, doctor, you don't know what you have done. After my marriage, I started seeing how my husband looks, how my kids really look, how is the nature all around me. It's a life-changing experience for me. So on daily basis, doing these things makes me very, very happy. Other things, teaching. I really love training the cornea surgeons for the future. And third kick I get is by trying and discovering or researching new technologies. Like now, currently I am doing liquid cornea for the corneal surgery. Like what I have worked on last 20 years, the limbal stem cells. Now I feel the liquid cornea is something which is going to change how we practice cornea in future. What traits makes me so successful? I really don't know what traits. Maybe others can see in me. What I know is there are few things that I begin to understand about myself. And one of them is that I can live with unpredictability, uncertainty very well. What it means? Like I will take up a surgery if the patient needs and if I believe that it's going to make a difference. Whether it's going to work or not, I don't know, but I do take those things. Secondly, I think I'm very open and I'm very inclusive. Whether it's my patient, my fellows, I talk to them, share with everyone. Whatever the excitement I have, I share with them. I'm generally a very positive person and I do not have any kind of guilt feelings. Even if the things go wrong, I feel bad temporarily, but then I come out of it very quickly. And I think it's very important for a surgeon to have very quick decision making. And that is something I can say I'm gifted. I just make those decisions very quickly during surgery or without the surgery. Challenges. Well, life is full of challenges. Where to start, where to end. Anyway, I'll count few of them. First challenge I had when I joined LVP. There were 6 cornea specialists way back in 1998 when I joined. I was the 7th one. So, most of the surgeons said, Dr. Sangwan, what you will do? We don't have enough work for us. What is that area you will work on? I said, well, you don't worry about, I will not get into your way. I won't do any surgeries which you are doing. So what you do is, the patient which you don't want to see in your OPD, please send it to me. The surgeries which you think there's no value, please refer those to me. What I end up seeing, patients with chemical burn, Steven Johnson, OCP, Moran's ulcer, very bad VKC. And I'm very glad that today, after 20 years, each of them have excellent techniques that we have developed and we have made life better for them. Another challenge, I started using immunosuppressives for my OCP patients, my VKC patients, systemic steroids. So some of the patient would come back and say, Doctor साहब, आपने बताया नहीं मुझे तो कैंसर है और आप एंटी कैंसर दवाई दे रहे हो. Then I'll counsel them. Therefore, this is not cancer. This is a new treatment. Even within LVP, I was criticized that I am using very toxic medicines for treating patients, and where the diagnosis is also not very clear. Third challenge I think is more important is people in general not accepting or not realizing the values of technologies. So sometimes when you are ahead of time, it is difficult for you to convince. But I think what you have to do is just do it and communicate it properly. If I have to do or live life again, what specialty I will choose? Well, it will be cornea, but this time by choice. But more important than choosing one specialty over other is, I think, what you do within the specialty, that is what matters, rather than which specialty you choose. So I believe that if you choose any specialty but you make a difference, you should start asking question, what is that I am going to do within this specialty, rather than what the specialty will do for me. How I am going to make a difference? My suggestion is, go after something which everybody says is difficult to solve or there's no treatment. You must go after that. At least you have 20-30 years to work on it. So that's my major reason that I would choose cornea, because there are so many other problems which I think I will not be able to solve in lifetime. So I would do it all over again, and find solution for which are treatment of cornea, which are incurable conditions currently. So my advice to all of you is, don't get entangled in the mind about decision making. Go with your gut feeling. What is that you like? And once you like it, go give your life to it and make a big difference. And that's what is going to matter at the end of the day and at the end of your life. Thank you.